Hi, and welcome to COVID Quickly, a new Scientific American podcast series.
This is your fast-track update on the COVID pandemic. We bring you up to speed on the science behind the most urgent questions about the virus and the disease. We demystify the research, and we help you understand what it really means.
I'm Tanya Lewis.
And I'm Josh Fischman.
And we're Scientific American's senior health editors. Today, we're going to be talking about the new Johnson & Johnson vaccine, the race between declining cases and the rise of new virus variants, and new ideas about why the virus may trigger diabetes.
Tanya, we have a new vaccine, and it seems to work. Who made it, and has the FDA authorized it yet?
That's right. The shot is made by Johnson & Johnson, and it works. According to data submitted to the FDA, it had 72% efficacy in the U.S. clinical trial and 64% in the South Africa trial, where a worrisome new virus variant has been circulating. It also seems to protect against severe disease, with 86% efficacy in the U.S. and 82% in South Africa. In addition, the vaccine may also prevent transmission of the virus to unvaccinated people, although data are not yet conclusive.
Now just wait a sec, you said shot when you started talking, not shots?
That's right. Unlike some of the other vaccines out there, Johnson & Johnson's is just one shot, and it can be stored at room temperature for up to 3 months. The biggest hurdle right now is making enough doses. But the FDA Advisory Committee is meeting right now, and the vaccine could be approved very soon. There's some good news about COVID cases worldwide, Josh, but some other not-so-good news. What's going on?
Well, good news is that since mid-January, case rates have been dropping. Hospitalization rates have dropped too. For example, in the U.S., cases have dropped 30% during the past 2 weeks. The United Kingdom has seen a similar trend. And this, epidemiologists think, is really all about us being careful. Less group gatherings, activity restrictions that local governments put in place after that very scary Christmas spike in cases and deaths. And we're all wearing masks more often.
Well, that's good to hear, but what's the bad news?
Well, the not-so-great news is that several variants are showing up that may be more transmissible and may resist antibodies created by your immune system and even some of the vaccines. I spoke with Vaughn Cooper, an evolutionary biologist at the University of Pittsburgh, who has found more variants with mutations at the same spot on the virus. He thinks they appear because they help the virus to survive and to replicate. Scientists think we're okay now, but the big push is to get more shots in more arms to slow the rise of even more variants. Finally, you've learned about some new connections between the virus and another disease, right, Tanya?
That's right, Josh. Diabetes is a known risk factor for severe COVID. But now, many doctors are reporting that COVID may actually cause new diabetes diagnoses. Some experts think the novel coronavirus may infect the insulin-producing beta cells in the pancreas, but this idea is somewhat controversial. Another possibility is that the viral infection causes diabetes symptoms, or that steroids, which are used to treat severe COVID and can raise blood sugar, may be having a similar effect. Finally, these new COVID-related diabetes cases may just be existing disease that doctors hadn't yet diagnosed. We don't yet know what's going on, but scientists are urgently investigating. Now you're up to speed. Thanks for joining us.
Come back in 2 weeks for the next episode of COVID Quickly, and check out SciAm.com for updated and in-depth COVID news.